You said you hated the ocean, but you're surfing now. I said I love you for life, but I just sold our house. We were kids at the start, I guess we're grown-ups now. Couldn't ever imagine even having doubts, but not everything works out. No, now I'm out dancing with strangers. You could be casually dating. Damn, it's all changing so fast. Así es la vida, así. Yeah, that's just life, baby. Yeah, love came around and it knocked me down, but I'm back on my feet. Así es la vida, así. Yeah, that's just life, baby. I was barely standing, but now I'm dancing. He's all over me. Ba-da-bum, bum, 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 bum. Ba-da-bum, bum, 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 bum. Ba-da-bum, bum, 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 bum. Ba-da-bum, bum, bum, bum. Así es la vida. Ba-da-bum, bum, 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 bum. Ba-da-bum, bum, 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 bum. Ba-da-bum, bum, 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 bum. Ba-da-bum, bum, bum, bum.
It's been a hell of a year, thank God we made it out. Yeah, we were riding away and trying not to drown. And on the surface I held it together, but underneath I sort of came unwound. Where would I be? You're all that I need. My world, baby, you hold me down. You always hold me down. Well, I've been the breaker and broken. Every mistake turns to moments. Wouldn't take anything back.
Así es la vida, así. Yeah, that's just life, baby. Yeah, love came around and it knocked me down, but I'm back on my feet. Así es la vida, así. Yeah, that's just life, baby. I was barely standing, but now I'm dancing. He's all over me. Ba-da-bum, bum, 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 bum. Ba-da-bum, bum, 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 bum. Ba-da-bum, bum, 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 bum. Ba-da-bum, bum, bum, bum. Ba-da-bum, bum, 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 bum. Póngale azúcar, mi gente. Sigue bailando, hey. Sigue bailando,
Keep dancing, yeah.
sigue bailando,
Keep dancing, yeah.
sigue bailando, sigue bailando, sigue bailando, sigue bailando. Así es la vida, así. Yeah, that's just life, baby. Yeah, love came around and it knocked me down, but I'm back on my feet. Así es la vida, así. Yeah, that's just life, baby. I was barely standing, but now I'm dancing. She's all over me. Now I'm dancing.
Keep dancing, yeah.
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 We redefine your lifestyle. City 1051 FM, your number one lifestyle station.
Since 1947, the matter never settle. You be but I be kettle. Masability lo nyawo lenu. Better recognize, greatest of all times. No other name they go call mine. As I dey shanty them not nice. Monday, Dada. Tuesday, Talaba. Wednesday, Dada. Slongest night, Jalaba. And they call me the Godfather. Move like an Italian. Have you ever seen a like one? Each and every lady wanna give me mwah. With this, in this, yeah. Now we there, I turn on mwah. I know two pass, give me Solomon. I get high, journaling. You know like me, one of them.
Most of of the contracts in NDDC are given out to members of National Assembly, but you don't know about it. It's okay.
When you need unbiased information, balanced analysis, reviews, and insight on the policies and programs that concern you, listen to City Talks with Ruben Abati. Be a part of it. Call 0700 1051 1051 to lend your voice on topics and help shape our country for the better.
My name is Ruben Abati. I will be your host on City Talks from noon to 1 p.m. every Saturday. Join me as we dissect major issues of public interest. You will be glad you did.
City Talks with Ruben Abati on your number one lifestyle station, City 1051. From noon to 1 p.m. every Saturday.
Good afternoon and welcome to another exciting edition of City Talks with Ruben Abati on your number one lifestyle station, City 1051 FM. This is a show where we discuss political and human interest stories that impact on us as Nigerians as well as members of the global human community. Today our focus is on cholera, what looks like a cholera epidemic. We don't think there will be that the cholera epidemic will become a pandemic. But all the same, it is a public health challenge. And it is my pleasure to introduce our guest for today's discussion. She's a consultant gastroenterologist and hepatologist at the National Hospital, Abuja, Dr. Jamillah Okpatuma. Dr. Jamillah Okpatuma is a gastroenterologist and hepatologist with the National Hospital, Abuja, a fellow of the West African College of Physicians in gastroenterology with over a decade's experience in caring for patients with a passion for clinical excellence. She earned her MBBS with honors in surgery from the University of Jos. She's an associate fellow, National Postgraduate Medical College of Nigeria. She was an emergency preparedness and plan doctor at Doctors Without Borders, during which she led interventions in cholera, meningitis, and Lassa fever outbreaks in Katsina, Borno, and Bauchi states. Now, the Nigerian Center for Disease Control and Prevention, NCDC, reported that as of June 11, 2024, there have been 1,141 suspected cholera cases across 30 states since January 1, 2024. The most affected states include Bayelsa, Lagos, Abia, Cross River, Delta, Imo, Katsina, Nasarawa, and Zamfara. On June 9, 2024, Lagos State declared a cholera outbreak. As of June 12, 2024, 324 cases, suspected cases, were reported, with 15 deaths and 40 discharged patients. The outbreak has spread to neighboring states, with cases reported in Oyo and Ogun states. The update on the death toll from the latest cholera outbreak has hit 24, with 417 suspected cases and 35 confirmed cases across the state's local government areas. Also, the Nigeria Center for Disease Control says the country does not have enough vaccines. According to the Director General of the Nigeria Center for Disease Control and Prevention, Dr. Jide Idris, Nigeria has placed an order for more cholera vaccines from donor agencies, even though the date of delivery is still unknown. Today's discussion will explore what this outbreak reveals about the state of healthcare in Nigeria, the causes of the disease spread, and how it can be controlled. To join the conversation, call us at 0700 1051 1051 and WhatsApp at 0909 916 4403, or reach out on our social media accounts at City 1051 on Zoom, Instagram, and Facebook. Good afternoon, Dr. Okpatuma. Thank you for joining us today. Hello, Doctor.
Good afternoon, Dr. Ruben. Pleasure to be here.
Well, thank you very much, Doctor. Well, we survived the COVID-19. It was called a pandemic. Now, Nigeria is in the throes of a cholera epidemic. I don't think it has acquired enough significance to be called a pandemic. But 30 states, over 19 local governments across Nigeria are affected. Persons have died. More than 40 people. In some accounts, they say over 400 people have died. We don't even know the exact number. But doctor, what is responsible for this spread of cholera? Just after we're trying to get out of COVID and Lassa fever.
Okay, thank you for that. I'll start by just briefly, talking about cholera. Cholera is a highly contagious disease, and it's a life-threatening diarrheal illness that is caused by cholera toxin-producing strains of a bacteria called Vibrio cholera. There are a lot of diverse species, over 200 species of this bacteria that is responsible for this disease. But the most common are the 01 and 019 serogroups, which have been associated with illnesses. To understand why cholera is with us, it's good to know the mode of transmission of this disease. And it's through the fecal-oral route. What does this mean? It means for one to contact this disease or this infection, the person must ingest the bacteria in contaminated water or food. Okay, and there are some situations that can place an individual or a community at risk of acquiring this infection or this disease. So if we want to look at it at the community or people level, we can talk about the economic status of that community. So it's very common in areas of low socioeconomic status. So we are very much aware that Nigeria is said to be among the third world countries, and this is because these areas would have lack of access to safe pipe-borne water. There will be problems of adequate sanitation, poor hygiene practices. We still have people who practice open defecation. They just pass through outside in open areas, not in toilets and well-built toilet systems with good sewage disposal mechanisms. So these are things that can, make a community or, people prone to this infection. And then also there are some risk factors that have been found in some specific, individuals that may predispose them or make them at risk of acquiring this infection. So research has shown that people with the blood group O are prone to having this infection for complex reasons. And then also there is a condition we call hypochlorhydria medically. This just means that the quantity of acid in our stomach, which is meant to help with food digestion and also destruction of these bacteria, is low for some reasons. Many people have had surgeries before, and then more commonly people, may be abusing drugs or using drugs in the long term for conditions like ulcer, which reduce this acid level that is unable to destroy this Vibrio cholera. And so once there is ingestion of the small amounts that may not have caused any harm in someone who has enough of this acid, it tends to cause this infection. But looking at it in our setting, we could talk about the socioeconomic status, like I said, and also poor utilization of vaccines where available, because use of vaccines is supposed to confer some form of immunity and protection against this disease. Okay, so I'll stop here for now and take more questions.
Well, Doctor, just for public enlightenment purposes, some people have been saying that we have this cholera outbreak because it is a rainy season, and that because it is also festive season, Salah, and during Salah people will eat all kinds of meat, drink a lot, and that has resulted in the figures rising. Does this have anything to do with the rainy season? Hello, doctor? Hello? Hello, Dr. Okpatuma? Can you hear me? Wow, what happened? Did we lose connection there? Okay, I just wanted to clarify a number of things about, what leads to cholera. She has already described for us what the ailment is all about, but I've seen reports saying, it's seasonal. It's because it's rainy season, and it's because people were eating carelessly during the festive period. Dr. Okpatuma, if you can hear me, do we still have connection with her?
Yes, I can hear you now. I lost you for a bit, but I can hear you now. Can you hear me?
Yes, I can hear you. I was asking you whether this has anything to do with the rainy season or with the festive period that we just had.
Okay, so for the rainy season, yes, the outbreaks tend to peak, or cases of cholera tend to peak in the rainy season because there is increase in flooding, increase in the water levels, and then this washes the bacteria across farms, across water bodies, because some areas still depend on rivers and streams as their source of drinking water. And then if the people in the community practice open defecation, the rain just washes away the feces which contains the bacteria into these water bodies and then contaminates the water, and then people drink and get infected. And then for festivities, I'll link that more to some form of crowding, where people that are infected may be in a cluster of others, and if they don't practice like hand hygiene, or they don't cook for that group of people during the festivity period, if they cook their food with contaminated water, or don't wash their vegetables properly that they serve at the festivities and all of that, yes, that can also be a source of great numbers of this infection.
But doctor, we have in the papers today this shocking story that Nigeria has run out of vaccines. WHO says there are oral cholera vaccines, Dukoral, Shankol, and Uvicol Plus. But these vaccines, were told, are no longer available in adequate doses in Nigeria. Well, and we don't even know when the next delivery will arrive. It's like NCDC saying, well, we have approached donor agencies, but we don't know when the next batch of supply will arrive. So, how is this? How do we survive? What can the people do? Because it now looks like we are on our own, technically.
Yeah, globally there is actually a shortage of the supply of these vaccines. So we really, as a people and as individuals, we need to hinge on preventive measures to, survive this epidemic. So first and foremost, just like we are doing now, health education is very, very key, very important. We need to create awareness. We need to let people know what this disease is. We need to let them know how they can contact the disease. We need to let them know how they can prevent the disease. It's very important to have access to safe water, safe drinking water. So we should always ensure that our water is boiled for those who can treat their water, ensure that water is treated, covered properly to avoid contamination. And then also we need to improve our sanitation facilities and practices. So the government needs to provide, even in rural areas, latrines, water systems, and also talk to the people about behavioral changes. So campaigns need to be done to talk to people about preventing open defecation, avoiding it completely, even if it means, enforcing laws to punish people that practice open defecation. That's not fact. That won't be too much, to prevent contamination of this water, because this is rainy season, like I said. So the rains cause floods. We just wash away the feces into water, and there are some people that still depend on this.
Hello, doctor. Hello, doctor. There seems to be a problem with the audio connection. Hello, doctor.
Also, simple things like hand washing. Before you eat, make sure you wash your hands. Before you use your fruits and vegetables, make sure you wash them. You can wash them with salt water solutions. If you can afford white vinegar, you can wash with that, so that we ensure that these foods are not contaminated. And then also we need to equip our health care system, even involve all healthcare workers at all levels, give them simple case definitions, that will help them easily identify these cases so that they can treat them properly, and then also make sure consumables are available to treat these people. Simple things like the oral rehydration solution, because the major problem with cholera is the severe dehydration and its complications that arise from the watery stool that is lost in huge amounts. So we need to make sure that people are carried along, involve the communities, the community leaders, women leaders, youth leaders, let them know that this is really simple to identify. Once you see someone passing watery stool, especially now that an epidemic has been declared, you should quickly rush the person to the nearest healthcare center, and then these healthcare centers and facilities should be equipped with the simple consumables that we need to manage these patients. And then, of course, the government also should collaborate with other agencies like World Health Organization, UNICEF, to have access to these vaccines. And then we should also try to improve, our researches, health funding, so that we can also manufacture these vaccines in Nigeria, which will reduce our self.
Hello, doctor. Hello. Hello. Dr. Okpatuma, are you there? Well, we have a country where you can be sure about network connections. But Dr. Okpatuma, if you're still there, I was most interested in what you were saying about what individuals can do to protect themselves in terms of prevention, and what other steps that government needs to take to make sure that people are safe. And I was just going to ask Dr. Okpatuma whether, in fact, for sure, we can just conclude that cholera is a poor person's disease, because the emphasis was on the fact that person's economic circumstances and situation, and that people in rural areas who engage in open defecation are most at risk. So can people who consider themselves comfortable, middle class, upper middle class, just go to school and say, well, that's not something that affects us as members of the middle class or upper middle class? Or is it a general thing that everybody in society has to worry about? Well, we're still waiting for, Dr. Okpatuma to regain connection with us, and for the engineers at the back end to make that possible, just in case the disconnection is from this end. But the point is out there, as made by Dr. Jamillah Okpatuma, that people have to take basic hygiene precautions. They have to be careful what they eat, what they drink, because indeed the major issue about cholera is that it's contagious. But I was just waiting for our expert opinion on whether indeed privileged people can assume that it doesn't concern them. While we're trying to sort out the technical problem in the studio here at this end, let's quickly take a short break and hope that that will be sorted out very quickly. To join the conversation, you can call us on 0700 1051 1051, and you can also join us on our various social media platforms at City 1051. We'll take this short break and we'll be right back. Stay with us.
It's your girl, Nirma, and Nirma is a musician. I should have said presenter first. Let me take that again. Hey, it's your girl, Nirma. Nirma is a presenter and a podcaster.
The voice of love. My name is O'Daniels for short. OAP at the radio station in Lagos.
Koyitola Olukoya, producer and red carpet host.
Code, I'm an honor personality.
My name is Rumet, compare and a creative.
I participated in the City Media Academy.
One of the best decisions I've made. Immersive classes led by seasoned industry professionals.
It made me happy and absolutely.
It was a launchpad for my dreams.
It cured my stage rights.
It doesn't just cater to radio. So if you're looking to further your career in the media.
Hey, you know what? Come on down.
Next session starts July 8, 2024. Visit plot 11 Latif Jakande Road, Agidingbi, Ikeja. Call 0810-968-8638 or www.city1051fm.com. Click on the CMA page for more. The City Media Academy. Explore the world of broadcast media.
Talk about quality music, awesome presentation, and lifestyle to the maximum.
This is City 1051 FM.
In NDDC are given out to members of National Assembly, but you don't know about it. It's okay.
When you need unbiased information, balanced analysis, reviews, and insight on the policies and programs that concern you, listen to City Talks with Ruben Abati. Be a part of it. Call 0700 1051 1051 to lend your voice on topics and help shape our country for the better.
My name is Ruben Abati. I will be your host on City Talks from noon to 1 p.m. every Saturday. Join me as we dissect major issues of public interest. You will be glad you did.
City Talks with Ruben Abati on your number one lifestyle station, City 1051. From noon to 1 p.m. every Saturday.
Recording in progress.
Welcome back from that commercial break. If you are just tuning in, this is City Talks with Ruben Abati on City 1051 FM. Today we've been discussing cholera and how it is a public health challenge. And our guest has been Dr. Jamillah Okpatuma, consultant gastroenterologist and hepatologist at the National Hospital, Abuja. Remember, you can join the conversation by calling 0700 1051 1051, and you can message us on WhatsApp at 0909 916 4403, or you can engage with us on our social media accounts at City 1051 on Zoom, Instagram, and Facebook. Now, I think we have Dr. Okpatuma back with us now. We lost connection with her just briefly. Hello, doctor. Are you there? Can you hear me?
Yes, I can. Can you hear me too?
Okay, very clearly. I can hear you now because there were issues.
Sorry for the break.
No problem. You were talking about what individuals can do to protect themselves and other steps that government needs to take. But I was asking, is this a poor man's disease? Because you talked about circumstances, you talked about rural population. Is it something that people in the middle class, upper middle class can say, well, because of our situation, we don't need to worry about cholera. It's a poor man's disease. Can anybody take that position?
Not entirely so. We all need to take responsibility because anybody can be affected by this disease. However, it is more common in those in the low socioeconomic status or the low socioeconomic class because they are the ones who won't have access to safe water. They are the ones that are more likely to practice open defecation. They are the ones that are most likely, from lack of awareness and enlightenment to reject the vaccines if available. So that's what puts them at more risk. But if these people come into the community, because we could go, the middle class and the high class could go to the markets and buy fruits, vegetables, from these people, or some of these people may even be workers in the homes of these people, domestic staff, and they could transmit this if they don't take responsibility, like hand washing, proper cooking of the foods they buy properly, or washing them and all of that. So nobody is entirely safe, but it is more likely to affect the low socioeconomic class.
Well, doctor, you refer to government responsibilities in this regard. Now, I recall that goal number 6 on the Sustainable Development Goals deals specifically with clean hygiene and sanitation. And Nigeria is part of the WHO program on water, sanitation, and hygiene, what is called WASH. Is this an indication that we're not doing very well without goal number 6 of the Sustainable Development Goals? SDGs, as they're otherwise known.
Well, we can do better. We can do better because this is really very basic, Like you said, water is very basic and should be provided by the government, at every level. So it shouldn't be a thing of the elites that is only the elites or, those in the high socioeconomic class that should be able to avoid, I beg your pardon, that should be able to have access to clean water. So we can do better really, and this epidemic occurring really shows that there is a lot that still needs to be done. It shows that there are still a lot of gaps that need to be filled, and we should still do a lot more to achieve that aim or that goal as soon as possible. So yes, we can do better.
Okay, but what challenges do healthcare professionals like yourself face in managing this outbreak? What are the challenges?
Well, all right. So, like we already know the issue of the brain drain. So there are really inadequate numbers of healthcare workers across board, and the few that are available are overwhelmed. Now, secondly, Another issue we face is late presentation. So a lot of these patients, or individuals affected will usually come in with complications where you're now battling to, save their lives. If they had come in earlier, it would have been a simple, process of managing. Okay, just hydrate and all of that, and then also inadequate numbers of consumables, drugs, intravenous fluids, and all of that are required to treat these patients, especially in the primary and the secondary healthcare levels.
Okay. Well, maybe at this point, Doctor, let's throw the lines open so that we can take reactions from people who also want to contribute to the conversation. As I said earlier on, the lines to call 0700 1051 1051. You can also message us at 0909 916 4403 on WhatsApp, and then also via social media accounts at City 1051 on Zoom, Instagram, and Facebook. Let's see who will go first. I think that there's someone on the line. Your name, your location, and please keep it brief. Good afternoon. Good afternoon, Dr. Moses.
Good afternoon to you.
Yes.
Thank goodness you are here today. Anyway, I read the doctor on the other end. Now, along the way, she raised some questions, some, pertinent ones like that. And I'm going to take on that. One is, are you implying that by virtue of your blood group O, or is it O plus, she said now, you are more prone to contracting cholera? Does it mean that cholera is maybe of nature, many things are different in nature and nurture? It's not entirely an environmental disease. If I'm A plus and I don't do anything, am I not going to contract the disease? That's that aside. Now, with respect to society, this is where we should be concerned more about the grassroots government. I'm talking of the local government. They are made up of the chairman, your councillor, your this and that. We only focus more on what happens at the center. Oh, Jonathan was this, who is that, why was it? We have to look at, on Thursdays in Lagos alone, if you can almost estimate that in the millions, if not the billions, that they collect from marketers, because on Thursday they have their so-called environmental sanitation in the market. That's why they open very late, on Thursdays. Yet our markets are filthy, and that's understating it. I've been to one or two other countries, and you see a modicum of decency, modicum of health, hygiene. But here, which market are you talking about? Is it Mushin? Is it Jankara? Whatever. These places are dirty. We don't take on our local government chairmen. We should. They collect rates. Why would there still be open defecation if we have working local government chairmen? That's my concern, because this essentially brings about these diseases that are preventable. So again, the doctor, I asked her, are you implying that cholera in that sense is a bacterial disease? Is it of nature, not more of nurture? That's just my question. Thank you.
Okay, I'm sure Dr. Okpatuma heard you, and because of the importance of those two questions, I'd like to go straight back to Dr. Okpatuma. Is it blood type that determines whether somebody, will be predisposed to the cholera disease, the contagion, or is it as a result of habits, of environment? And then secondly, the role of local government councils. That may be a bit political, but I recall that once upon a time in this country, we had sanitary inspectors, people that, Yorubas called wole wole, tanwujin yom wole coming to look at your source of water, even apocryphally, we were told that those sanitary inspectors even inspected people's pot of soup to be sure that the meat was properly cooked. And in doing so, they help themselves to one or two pieces of meat. So, that was at the local government level. So, are we saying we should have sanitary inspectors back, environmental officers to be more vigilant, to compel people to be cleaner? Dr. Moses just said, look, in Lagos, they have environmental sanitation in the markets on Thursdays. Even then, even with that, those markets are filthy. They are, terrible spaces for all kinds of infections. So, Dr. Okpatuma, what do you think?
All right, thank you. So for cholera to occur in an individual, there has to be an interplay of 3 factors, and these factors are: 1, factors in the individual himself; secondly, factors from the environment; and then thirdly, factors from the infectious agent, which in this case is the Vibrio cholera, the bacteria. So there has to be an interplay between these 3 factors for the organism to occur. So talking about the risk factors in the individual himself, that is the host. That's what we talked about, things like the blood group, the hypochlorhydria, the immune status, and then in the agent itself, that's the Vibrio cholera, there's what we call the virulence of the organism, so the degree to which it can cause disease, okay? And then also, the third agent I spoke about is the environment. So this does not happen in isolation. There has to be an interplay. That's why we are placing emphasis on the environmental hygiene, because that is very strong. So I spoke earlier about proper sanitation, access to drinking water, prevention of open defecation, and all of this. And like you rightly said, the local government has a role to play, and they can, they can enforce these things. If the simple, those poo outside does not suffice, then you can implement, law enforcement to ensure this, so that lives will not be lost as a result of this. And I think it's something the government should look into. Yeah.
Well, there was the point I raised about these sanitary inspectors of old, who go from house to house, door to door, checking whether even families, basic families, whether they were hygienic enough in their basic environment to prevent any outbreak of disease. Do you think state governments, local councils should go to that old practice of enforcing hygiene by finding people who are dirty?
Yes, I think it's a way to go, because for this epidemic to keep coming on and on, and we can actually identify these areas, clearly, to have poor hygiene, to have bad practices like open defecation, then yes, turning that line will go a long way to curb this, so that we can prevent the outbreaks from reoccurring and claiming lives. So yes.
Okay, we're still expecting more interventions from the public, but I would like to ask you, during COVID, there was this talk that, by the time we reach a certain level of spread, COVID will on its own just peter out. Is it the same with cholera? Is it, a bacteria that it reaches a certain level in the population and people will develop natural immunity against it?
Well, cholera is a vaccine-preventable disease. So if there is proper utilization of vaccines, people will get immunized, and then with time, as the generations pass by, the cases may reduce. But also it's important to note, like I said, there is always an interplay between the host factors, the agent itself, and the environment. So we must also enforce, we can even enforce policies to make sure that the environment is safe, so that this organism does not thrive.
Okay, we have a response from Adegboyega Adedeji here. He says, we can't talk about cholera pandemic in Lagos State without talking about the dilapidated and collapsed structure of water system in Lagos. The office of the Water Corporation has become a shadow of itself compared to what I witnessed in the 70s. 98% of Lagos homes can't boast of pipe-borne water direct from the Water Corporation. Over the years, underground water pipes have been abandoned as a result of no flow of water from the State Water Corporation. Some are destroyed due to road construction and laying of communication cables, and year in, year out, money is budgeted for cleaner water in the state. You wonder where this money goes to. Adegboyega Adedeji. Well, we'll hold on with that. There's another caller on the line. Hello, good afternoon. Hello? Hello, good afternoon. Okay, looks like we lost that call. But, okay, the caller is back. Hello? Hello? Well, okay. Dr. Okpatuma, this last person, Adegboyega Adediji, is talking about government even destroying infrastructure for water provision. He has cited the example of Lagos State, but it's probably not just Lagos State. It's probably a nationwide problem. But beyond that, I would like you to do an assessment of how the NCDC, National Center for Disease Control, has been managing this, development. I mean, I'm shocked that the Center for Disease Control comes and says, we have this problem, but we don't have vaccines. We are looking for help from donor agencies. I mean, we don't have enough vaccines to deal at the back end with meningitis outbreak, to deal with Lassa fever outbreak. We have to go cap in hand. What is the level of research and technology in this country to be able to address some of these basic epidemiological challenges that we face? Where is the missing point? But while you are thinking about that, I think the caller is back again. I hope he or she succeeds this time. Good afternoon.
You never succeed. Back briefly. I want to ask the doctor, and you, because you are influential, we can't deny the fact that Dr. Ruben Abati is a voice in Nigeria, if not in Africa. I remember what happened in 1996 when Pfizer and some pharmaceutical companies came to the north and made some children in their hundreds guinea pigs. I'm sure you remember the story I'm talking about. And they killed them. Let me just say that word unequivocally now. I've never been wary of whatever comes from the West. That's why today I am a pandemic skeptic. I just feel something went wrong because of who machinated all manner of things. I just don't believe it was natural. Today, we are still cap in hand, going their cap in hand rather. We are still at their mercy. What are we doing in the health sector to fix things like this? What are someone like Dr. Ruben Abati contributing by way of his brilliant columns in newspaper, ensuring that these things are looking the way, putting our own vaccines there? I just don't trust anything that comes from the West. I just don't. 1996, I will never be healed of that trauma online because these pigs were just used as guinea pigs and they went almost scot-free. So what are we doing to ensure that these don't repeat themselves? The other day it was scandalous when it had to do with COVID. Today there is one company telling you that their own vaccine is not going to work with another vaccine and all manner of gibberish. So what are we doing to ensure that we are not always at their mercy? We must do something for ourselves there. Otherwise, God have mercy. Money.
Okay, thank you, Dr. Moses, intervening again. Let me come back to you, Dr. Okpatuma. The politics of vaccine production, which is what the point is all about. And we know we have to deal with challenges also of culture, of skepticism about whether the West can really help us. And why don't we have our own research and development and have enough stockpile of some of these common epidemiological public health issues? Yes, doctor?
All right. I'll start by saying I'm a clinician and not a politician. So from my own perspective, I believe that the government needs to have the political will. There needs to be more funding for researches to be done so that we can also be able to produce vaccines for vaccine preventable diseases. And this will be a giant step towards our self-reliance. And then also for vaccines that are imported, from other countries, the government needs to come up with, safety measures to check and ensure that these vaccines are safe. And most of the vaccines we use are actually safe. I can't comment on the Pfizer case because I don't have my facts at this point in time, what Dr. Moses raised, but I will strongly advocate that the government should ensure that there are safety measures put in place to check and ensure that every vaccine that is brought into the country is safe before it's administered to its people.
Okay, well, I hope that would satisfy Dr. Moses in that regard. But we also have Treasure Lawrence. He says, we are back to punishment for open defecation. What do we do to those who refuse to provide public facilities, safe drinking water for that purpose? What do we do? You already talked about political will, but what do we do to the people who refuse to provide potable water?
Well, from our own end, we need to keep advocating, advocacy. That's what we can do, to encourage them to provide even simple things like public toilets, go a long way. It will prevent people from just passing stools anywhere. Once the public toilets are available and they are properly set up, that would also go a long way. So we'll just keep advocating and hoping for the best, really.
Well, because there are no public toilets. That's what also James Agada is saying via Zoom here. He says because there are no public toilets in public places in Abuja, the task force must start with the provision of toilets. Well, those toilets, are they even clean? At motor parks and elsewhere. But there are some people in this country, doctor, who say that, look, we worry too much about COVID, about cholera, about all these public health issues, that something must kill man. And that, we worry too much about doctors advising us that, something must kill man. If you boil water properly and you cook, you heat it up properly, you will be okay. Will you advise people to take that kind of position?
No, we should all be responsible for our health. Yes, something must kill a man, but do your best at your own level to take care of yourself, and prevent the preventable, so that when death comes, it will be something that was really, really, difficult to handle. But these are simple things that shouldn't kill a human. Just contracting a diarrheal illness because you can't drink clean water. So we need to take responsibility for our health.
Okay, doctor, let me ask you. I think you've spoken about prevention. What can government do about public enlightenment? And what can medical units, hospitals, medical professionals also do to enlighten our people that you have to be careful about your own hygiene, you have to be careful about sanitation, you have to watch what you drink, you have to watch what you eat? What public enlightenment?
So first and foremost, we need to train and retrain people that would have the right information to pass down to the communities. And then we need to also make sure that the means of passing this information are very accessible and easy to reach, even by someone in the most rural area of Nigeria. So radio programs, jingles, and then we also need to carry people along at the community level. Okay, so we shouldn't just stay in the capital city, in the big cities, and then just keep talking and talking. We need to go into the communities. We need to educate these people in the communities. We need to involve, make them part of the process so that they can be carried along. And then this information should be passed in languages that will be easily understood by these people, so that even those who are not literate or not educated, easily understand and know the importance of preventing such diseases.
Well, we have another contribution here from Dr. Fortune Fiberisima, my very good friend. We were in the villa together in those days. He says, I think there is need to set up a task force in Abuja to monitor the big drains by the roads. They have all been turned into public toilets. That's frightening. But I guess it's not just in Abuja. I see people also, just turning public drains into toilets. That's his own suggestion there. And it's across the country. But let me add to that comment by Dr. Fiberisima. We are at a moment in Nigeria now where people are saying, oh, there is poverty in the land. They are hungry. Idris Abdul Karim just came up with one, song in which he was saying, people are hungry, below corn. Do you think this has to do with people being hungry? Does it mean that if people are hungry, they cannot drink, potable water and they cannot be hygienic? But we have another caller on the line. Let's listen to that caller quickly. Hello? Hello? Okay. We lost that call. So, Doctor, I'm back to you. Is it because there is poverty, widespread poverty in the land?
Hello?
Hello? Yes, sir. Thank you for joining us.
Yes. Thank you, Dr. Ruben. How are you?
I'm good. Thank you very much.
Yeah, this is Barrister Peter Ufu. I'm calling from Mende, Maryland.
Thank you, Barrister Peter. Please go ahead.
Yes, long time. God bless you.
Thank you.
Yes. On the issue of this cholera outbreak, it is an accident waiting to happen. Because the situation we find ourselves today in this country, where people are dying out of hunger, for you to be telling them about cholera, people don't even care. They don't. In Lagos, there are a lot of homeless people. They have no place to stay. Even those who have, many of them are living in a condition of squalor that is unfit for any human being. So the government has a lot to do. They have to do their work before you start talking of forcing people to obey environmental law. When Tunde Diakwo was alive, I know that time they used to practice this war against indiscipline. You cannot live in a very in such a condition of squalor and stay in a place where there is no pipe or water. They made it a point of duty. It became a culture. But after he passed away, what happened? We lapsed into our hygienic practice. So I think government has a lot to do when it comes to this cholera outbreak. We are lucky that it has not exceeded the situation it is now. So the earlier we take urgent steps to avert it, the better. God bless you.
Thank you very much, sir. Thank you for joining us. Well, very quickly, Adedeji is also back on this same subject. He says, while we are talking about cholera pandemic in Lagos State, with the state of hike in foodstuffs price, people not eating well, I pray we should not begin to experience kwashiorkor in children. Well, he's talking about kwashiorkor. Then we also have this person, his name is not indicated. He said he was beaten up before now at Ujodubaga because he had the temerity to tell someone that the trash was not properly disposed. And he's asking us to go check the bridges where people just throw refuse about anyhow. And if you complain, they beat you up. Back to you, doctor. Is this a cultural thing for some people to be dirty?
Well, food insecurity is actually a risk factor for cholera. Okay, so once people are hungry, they just tend to eat whatever is available. I have seen people take food from the garbage to eat, from refuse bins to eat, and that in itself is a predisposition to acquiring such an infection, because we know it's the disease of poor sanitation and hygiene. And then also people that are poor wouldn't have access to pipe-borne water, so sometimes you just see them, they can just drink water from a pond, from a drain, from a nearby stream, and that may be contaminated. So poverty is a big problem and is a big risk factor for cholera, and also hunger can predispose children especially to malnutrition, and malnutrition is also a risk factor, for cholera. So yes, the government really needs to do something to help its people out of the hardship. Food insecurity has to be tackled, pipe-borne water has to be provided, good sanitation practices, proper sewage disposal, and all of that are really necessary.
Okay, doctor, we'll take this last caller. Hello? There was a caller on the line. That will have been the very last call. Who is on the line? Poverty should not compel us to drink dirty water or to sabotage our own health. Hello, thank you for joining us.
Good afternoon.
Good afternoon.
My name is Bob from the Kingdom, Badagry, Lagos State. I know you are having a different topic entirely, but I've been interested in your topic because I used to listen to your radio station. I'm calling in respect of this bank that is recently liquidated by CBN, Heritage Bank. But I want you people to take it as a topic, and I don't know how you can give us so that people can come in and talk. The staff of the bank is suffering, the depositors too are suffering. You understand? In terms of, they can't just send people home without no job. You understand? And we want the lawmaker, the president, and the CBN governor, and the NDIC to look at the staff welfare. No payments of staff welfare, and they just ask us to go home. So I just want you to take, I want you guys, and listen to your topic on that thing on Friday, on the situation of the nation, that you people have pity out for us, that people can come in and talk. You understand? So that's the reason why I'm calling.
Okay, sir. Thank you very much. We've noted your concern about the withdrawal of the license of Heritage Bank and the interests of depositors, customers of the bank, and the provisions of the law with regard to the National Deposit Insurance Corporation. Well, maybe we'll get around to that and give opportunity for stakeholders in Heritage Bank who may have been affected to come and have their say. But today we've been discussing cholera. And our guest is Dr. Jamillah Okpatuma. Dr. Okpatuma, well, as we begin to wrap up now, there are some, words of advice, guidance that you would like to, by way of summary, say to our listeners.
Okay, so I would like to summarize by saying cholera is very contagious and is a life-threatening diarrheal disease. And we need to take responsibility for this because it's associated with poor hygienic practices like open defecation, lack of access to clean and safe drinking water, poor hygiene practices. So we need to, step up our game in terms of our personal hygiene, hand washing, cooking with properly washed food items. And then also we should encourage people and talk to people as much as we can within our spheres and within our cycles to enlighten them to know about this disease and how to prevent this condition. And then if you notice anyone around you having diarrhea, that's passage of watery stools in this period, please don't let the person stay at home. Don't self-medicate. Go to the nearest hospital so that it could be treated. Once it is identified early, it can be properly managed and these complications and deaths can be avoided. And then I also want to advocate to the government to improve on areas that are deficient in terms of prevention of this disease, and that we as a people can be able to produce our vaccines. We have the capacity, we have the intellectuals available, so we just need that push, we just need the funding, we just need the support and the political will, and we'll get there someday. So we shouldn't get discouraged. Nigeria will get better.
On that note, I'd like to thank you very much, Dr. Jamillah Okpatuma, for sharing your insights with us today on this all-important subject of the cholera epidemic that is, rapidly across Nigeria. 10 states already affected. The fatalities continue to increase. Reported cases continue to increase. And I hope our listeners have heard you clearly that there is a role that individuals can also play to protect themselves, to prevent, being infected by the epidemic. And I want to thank all our callers and everyone who engaged with us on Zoom and Facebook. The conversation continues online. You can reach me on Instagram at Abati1990 and also follow at CT1051 on all social media platforms. For those of you who tuned in late, you can watch the full show on your YouTube page, City1051. And when you do so, don't forget to subscribe and leave your comments. And don't forget also to join us next week at 12 noon for another exciting edition of City Talks. I am Ruben Abati, and the show was produced by Rex Okiche, Oluwaseun Adetitun, Ayodamola Oludara, Oluwatobiloba Samson, and Abiodun Odunton. The executive producer is Adedoja Allen. Thank you very much for listening. Bye for now. See you.
Recording in progress. Recording stopped.
Most of the contracts in NDDC are given out to members of National Assembly, but you don't know about it. It's okay.
When you need unbiased information, balanced analysis, reviews, and insight on the policies and programs that concern you, listen to City Talks with Ruben Abati. Be a part of it. Call 0700 1051 1051 to lend your voice on